The following portion of My Carolina is sponsored by...
I'm so excited to welcome back to the show Elaine Loyick, the Vice President for Community Engagement and Government Relations, and Dr. Sharon Harrell from FirstHealth in Moore County, who is a Smiles for Kids grantee. Welcome to the show, ladies. Thank you for being here.
Thanks for having us.
Absolutely.
So
this is exciting. You know, we've talked about this a little in the past, and I think a lot of people are starting to get the hint that it's so important for oral health and to keep our mouths as healthy as they can be. But for those who aren't familiar with this program, what is Delta Dental and the Smiles for Kids program?
Well, Delta Dental is a not-for-profit dental insurance carrier, and part of our not-for-profit status means that a portion of our proceeds each year go back into North Carolina to fund our corporate giving as well as our foundation giving.
Right.
Our foundation Smiles for Kids grant program funds North Carolina nonprofits offering direct dental services or oral health education to children who are underserved. And I'm excited because since the 12 years of its inception, we awarded our highest amount ever, $150,000 among 39 nonprofits across North Carolina.
Wow, it's a big statement there, I think. Can you elaborate a little bit about the Kids Program Awards and what that is?
The Smiles for Kids awards nonprofits who are offering direct services such as cleanings for children, just like when you go to the dentist, for cleaning, the screenings. Some of the funds go to mostly for the county clinics if a child needs restorative care. So if there's a cavity, or even if they have to have a tooth pulled and an implant or a cap, it'll fund that kind of treatment. And the other is we have some museums who've received funding for oral health exhibits or oral health programming, school programs. So.
You know, it can have a stigma against it, and people can really be afraid to go to the dentist, but we don't want that to happen. No. We want to make sure it's comfortable and as less scary as we can make it. So I think having those programs at the museum, or just those simple exhibits that can get them involved and excited to go to the dentist, I think that really makes a huge difference, especially right here in our community. Dr. Harrell, let's talk to you about your grant and how the funding was used.
Yes, I'm excited to share that with you and so pleased to be with you today. First of all, I'd like to share a statistic, and that is that 20% of kids have 80% of the decay.
Wow.
And when I was doing literature research, some literature review this weekend, I saw that there's a little bit of controversy about those statistics. Some say that 15% of the kids have 80% of the decay. Other studies say that 25% of the kids have 75% of the decay. But the bottom line is that there are kids out there who haven't had early access to care, and those kids are the focus of our partnership.
Right.
And what we want to do is to get to those kids early before they get decay and before they become a statistic.
Absolutely. And you know, it's so imperative to start when we're young and form those habits so that when we are adults, it's not too late to get started.
Right. And we're going very early. We're going to daycares, and we'll be providing cleanings and fluoride varnish, early preventive care in a setting that's comfortable for kids. We'll be going to daycares and Head Starts. And through the generosity of the Delta Dental Foundation, we will be able to provide for each child a toothbrush, also toothpaste. And in the past, the American Dental Association warned that we shouldn't give fluoridated toothpaste to kids under 3. However, a few years ago, because of the great benefits of fluoride, now the updated recommendation is that kids who are 3 and under can have a smear of toothpaste, a rice-sized kernel, and kids 3 to 6 can have a pea-sized amount of fluoride. The foundation will also provide floss, and many parents worry about, well, should I floss a kid's teeth if they're just baby teeth? But if there are no spaces between the teeth, we definitely recommend using floss. And then the Delta Dental Foundation will also provide fluoride varnish, and we found that if fluoride varnish is applied over regular intervals, it can reduce the incidence of decay by up to 40%.
Tell me a little bit more about the work being done in Moore and Montgomery counties to reach these at-risk groups.
Well, we're excited because we're able to provide preventive care over the life cycle. In other words, we start in daycare, preschool, and then when the kids leave daycare, we have several options for them. One is that they can come to one of our freestanding clinics, or they can come to the elementary schools in Montgomery County where we have a portable dental program where we roll in the equipment. Cool. Then when they get to middle school, they can actually come to our school-based dental care centers, which are for middle school kids in Montgomery County. which also serves kids up to through high school. So we're able to provide care from birth actually to 21.
It's so cool that these kids aren't going to have to worry about having access to such beneficial ways to keep healthy. It's such a downer whenever you think that you can't do something because you don't have access to it. But now you guys are making it's at their fingertips, and it's really important for them to know how to get access to this, how to learn more about it. So with that, where do we learn more information about Delta Dental and the work that you guys are doing in the community?
Well, for Delta Dental, you go to deltadentalnc.com/giving.
If you're interested in any services with FirstHealth, www.firsthealth.org/dental or 910-692-5111.
Perfect. Ladies, we so appreciate you being here, helping get the word out there that dental health is imperative to our overall health. We so appreciate it.
Thank you, Carly.
Thank you.
The preceding was sponsored by